there were only, well, the year that I came through nursing school was 1971. I graduated from high school. I was 17. I went into a bachelor's degree program, a college program, and there were 2 male students, and both of them had been in Vietnam. They had both been medics, and they both wanted to go into to be a nurse practitioner as a anesthetist, nurse anesthetist, which was in anesthesiology, putting people to sleep in the OR. And they were my study buddies along with 2 other women, and we did the whole 3 years together, and it really was 4 years, but at that time we pushed it because all of us wanted to get out of school. We were ready to get out and be working, and so we pushed it, and we were able to graduate 2 quarters early. So I got out of nursing school and was 21, had my bachelor's degree, but I also wanted to go further in nursing, and I wanted to actually become a midwife, which I did. I had to work a year, and then I went back to school and I got a certificate in midwifery. And so I spent my first 30 years delivering babies. And then about 15 years ago, I switched and began to take care of end of life. And it's pretty amazing to be able to think that you've been able to watch people come in and watch them leave. And it's actually the opposite. The way we come in physiologically, what our bodies do as we come in, turns around and goes exactly the opposite for us to leave. But really what it was for me was, and I think this is what Phil was alluding to, when a family's starting, there's a transition. You've got a couple, usually, not always, but there's a transition to where you're going from being a single human being to being a parent, and there's a lot of support that people need to be able to do that. On the other end, when people are leaving, there's a lot of support that's needed. And that's the part of nursing that I've always enjoyed, is that I can help people make these life transitions. So what I did when I first went to school, when I first got out of school, was I went and worked in a small community hospital, and then got accepted to midwifery school, and then finished midwifery school and worked a year in the hospital that I was working at, so that I got some really sound experience, and then I ended up going in and starting a private practice. Okay, and I also, though, during that time, I worked in the burn unit. I worked as a private nurse in a small trauma unit with motor vehicle accidents, and also believe it or not, gunshot wounds, but that's these many trauma units that we would have. And all of that experience, and I say this because when people go to school, sometimes they have a set idea of what they're going to come out and do, but if you take as many experiences as that can be given to you along the way. I just recently had to work with a burn patient, and I was able to go back to almost 50 years ago of working in a burn unit, had the experience, it came forward for me, the knowledge. Same thing with some of the trauma cases that I've had to take care of. So just kind of, I wasn't fixed in the sense that I was able to branch out and do other things. Different today, we need more male nurses, I'm just gonna say. We need more nurses, period. I know you probably maybe see that on the news right now. There's a whole group of us retiring, and we have a huge shortage in healthcare coming up. And right now in the state of Washington, it's estimated that we need 6,500 nurses today to supply the need in the hospitals today. Anyone graduating in these next 3 years can be out of school, and within 5 years be in a good paying job in nursing. Nursing today, if you're at entry level, usually it's around $50,000 to $60,000 a year. If you've been, if you have, and that's if you have the start off degree, the 2-year degree. If you get a bachelor's degree, you're starting off somewhere around $70,000, and people who've had 6 to 10 years of experience are making over $100,000. So it's a profession that it's difficult. When you first start out, maybe crazy hours that you have to work because you have to staff 24/7 in most settings. But it is a livelihood that people can actually do well with. Lots of different areas you can work in. People work in public health. And by public health, I mean, as an example, right now there are a group of nurses working over in San Juan County with the whole issues around COVID. You can work in a doctor's office. You can work in the emergency room. And each of these now are also having specialties. So if it's an area that you decide to specialize in, there's a greater amount of income in it as well. So in our area, there are, and I know that some of y'all were up in Bellingham recently. So there's Whatcom Community College, and at Whatcom you're able to get what's called an associate degree. At Bellingham Technical College you can get an associate degree, and at Western you can get a bachelor's degree. Now what that means with an associate degree is that you can be done in 2 years and be taking the exam and be on the floor or in a clinic working as a nurse. You do, and that's probably the fastest route to be able to go. We did not have that available when I went to school in that same way. It was pretty much that you had to go the full 4 years to be able to sit for an registered nurse's exam. But that's available, and a lot of the classes are done online as well. I'm hoping that they will continue to get you in your education with direct patient care, but more recently they've been doing more simulated patient care. They'll have labs where you go in and they'll have where you'll do procedures on dummies rather than on patients. And so just as an old nurse, I just kind of hope that they don't take away as so much of the patient interaction. But you can be finished and have your licensing in about 2 years if you do the associate degree. You can then, if you choose to get a bachelor's degree, it can take anywhere from 11 months to 18 months to get the bachelor's degree. Let's say you got out of school and you went on and got a bachelor's degree in something else, you can actually go back and usually in about 11 months to 18 months, you can get your nursing degree and come out with the highest registered nursing degree that you can have. So it's not limited in the sense that they've expanded the way that you can get the degree. If you have the bachelor's degree, then you have the option of going on and getting a master's degree, being a nurse practitioner, being a nurse anesthetist. You can be a midwife. There are other paths to being a midwife, but you can be a nurse midwife. And you can also, now there are doctorates in nursing. They often are in the different universities and in an academic type of setting. I'm gonna stop for a minute and does anybody have any questions? Yeah.
How about,
Yeah.
You were talking about how you transitioned from like trauma to burn to bullet. Is there like training in between to prepare you for those specific sections?
There wasn't in the days that I did it. Today, there are certification courses that you can take in the individual areas. Yes. Yeah. But and I would say also, it's pretty easy if you assert yourself to get the on-the-job training that you need to, but you have to say, hey, I don't want you just to throw me in there, I want more training. But if you're gonna do ER nursing, then there is a certificate in ER nursing. There's a certificate in oncology nursing. There's certificates in different kinds of nursing that are just like these intensive 1 month, 6 weeks types of programs to get you oriented, yes. And many times the job will pay for that too, because they really want you in the specialty areas. Yeah. Yep.
how about travel nurses?
Okay, that's an interesting one. So you really want to make some money in nursing? Go into travel nursing. Because what's happening is right now, I mean, in fact, Michelle and I were having coffee before this, and up on my phone comes Ian from Core Nursing saying, would you like a travel nursing position? I know I know that I reached out to you 3 months ago, but would you still be interested? And what's happening is because of the nursing shortage, there are companies that are staffing nurses in hospitals. And recently, one of them reached out to me, and they wanted somebody in New York City. They'd pay your house, so you'd work in the ER, which is really a tough place to work, right? And they would pay for your housing, so that's a big deal in New York. They did want you to work a 60-hour work week, okay? But they want their money's worth. But you ended up making $12,000 a week. Now figure that out. And boy, I don't ever want to work in the emergency room, but I crunched the numbers. I was pretty shocked. Okay. And there's a little bit going on right now. I mean, there was an article this morning in the news about the unions are trying to protect, and many nurses are in unions. I happen to be in a union, and they're trying to protect the nurses who are staffing the hospitals, because we're not making that kind of money, right? And we're still having to work hard, and then they bring in travel nurses when we don't have enough nurses, and the travel nurses are working beside us, and they're making double the money we're making, and there's a lot of riffraff that goes on because of that. But travel nursing is a great thing. I can be honest with you, I considered it. What you do as a travel nurse is you take an assignment for 9 to 13 weeks, and you can choose what state you want to go to, or whatever type of setting you want to work in, and then you move on, or you could stay in that place and work another 13 weeks. Mm-hmm.
So if you're a travel nurse, and you said they pay for your housing, so you have a family, will your family be able to come with you, or would it just be you?
It depends on how you do that. I mean, some of them, what they do is they'll give you a subsidy. I know a nurse who had a family, and they had a tiny home, and they'd pull it, and they'd live in their tiny home while she took that really tough shift, and he took care of the kids.
I met a guy when I was heading down to SeaTac to fly out somewhere, and I took the light rail, and we were both walking at the same pace towards the airport, and he was from Bellingham. Well, he was a travel nurse, fairly young guy, I don't know, 30-ish, and I was asking him about that, and he said, oh, it's great. And he described what you were saying, and he said when he started out, he got a pickup truck and a trailer.
Yep.
And so he not only gets the salary, but he rakes in the
Subsidy.
housing per diem that they would give him to stay in a hotel or something.
Yep.
And he parks at trailer parks for 9 to 13 weeks, whatever it is, and then when he's done with that assignment, he goes off and travels for a few weeks, or drives to the next location. Anyways, he just loved it.
Wait, so does traveling nurses, like the New York example, does that mean they're working in different hospitals in New York? So traveling? Okay.
Yep. But I also want to say that when you're thinking about a career in nursing, how do I say this? It is so varied. I mean, you could be someone who is doing the ER, which is a lot like what you see on the television in ER. I mean, it's a hectic, crazy setting to be in. You could work in the OR, which in my opinion is one of the most boring places to have to work, because you're doing surgeries and standing and waiting for other people. I mean, you're the nurse and you are going to be handing off instruments and whatever, but it tends to be very mechanical. For me, it was important to be able to have communication with people and to be able to do education. There's management, there's research, there's pharmaceuticals, there's, I mean, honestly, I can't imagine any area that I couldn't find work in. And that's probably what was one of the motivating factors for me was I didn't want to not have the opportunity for work, a career. From the time I started, I wanted to be able to see myself to the end being able to have, you know, a decent or good income. But I don't do real well with trauma. I'm usually the one, like recently I took CPR here at the fire department, and I know a couple of the fire guys, and they said, "Oh, I can't wait to see you on the scene of an accident." And I said, "You won't." I said, as soon as y'all get here, you will look around and I won't be there. Or you'll look around and I'll be over there working with whoever's shown up, family member, something that needs help in making the transition about the trauma that's going on. I don't have any interest in taking care of the guy who's, you know, bleeding and or has the trauma. So we're all different in how we would want to do that. And I don't think actually that we're finding anymore. Used to, males were more, you know, we would place a gender on the different areas of nursing that men would work in and women would work in. That's not true anymore. You know, it's just all across the board. Other thoughts or questions? So we've actually got four areas that you can go into nursing here. And the one other thing I wanted to say was, I believe we're gonna see more funding come up to help with school for nursing. And I encourage, if that's something you're interested in at all, to really reach out and start, you know, looking for it, because so many people are coming out of school today with debts. I think that we're gonna see, because of our healthcare shortage, you're gonna see more monies available for you to be able to finance your education too. And that was not present. There were small loans available when I went to school, and small scholarships, but I think we're gonna see more here shortly. Somebody had their hand up?
Oh, I had a quick question.
Yeah.
What is the current ratio of female to male, roughly, do you know?
I'd have to guess at it,
Yeah,
but
yeah.
I would say probably 10% male.
Really?
Yeah. I would say probably so, except for in an immigrant population of nursing. One of the things that I saw in Seattle was, so one area that we really are desperate for nurses right now is in our facilities for the aging, because we're gonna double the number of people over 65 in the next 20 years. And we're going to double the number of people that are over 85, because people are living longer. And because of our situations of families, etc., people do end up, and because of chronic healthcare issues, they end up in facilities. And so we need nurses to staff those facilities. And so for the last 10 or 15 years, there was already this drop off of nurses, and there were a lot of the nursing assistants who came in, and particularly, this is gonna be interesting, males from Africa, from Eritrea, from Ethiopia. And I noticed this in Seattle in particular. They were amazing caregivers. I had great respect for them when I was going in to see my hospice patients there. They had a lot of initiative, and 10 years later, I would go back in, I've been back in, and they're the nurses now staffing the facilities, and they're excellent nurses, and I am so glad they are replacing an older generation of female nurses who are kind of burnt out and tired. And I could say that about myself, except for the fact that I keep myself motivated by finding areas of nursing to work within. And So there's a population of male nurses that are coming in, but we desperately, in my opinion, need more, because it's a profession that could really use a better mix. Really could. And I think we're finally recognizing that nursing should be paid appropriately. Because I think it would have been difficult for many head of households to be able to work on that salary. A lot of men come into nursing from being EMTs. I think it's a great way to maybe even start. Come in from being a nursing assistant. Even if you had 3 months of nursing assistant experience or caregiver experience, you'd be able to use that on your resume to get into nursing school. Here on the island, let me talk a little bit about caregivers since I just mentioned that. So when I take care of someone who's on hospice, their care is being provided by their family. Now, Michelle's husband was very fortunate because Michelle was able to provide his care. Phil was able to be there for his wife. We have a lot of older families here on the island where the wife may not be able to take care of the husband, or the husband may not be able to provide the physical care that's needed. So we have caregivers here on the island. You do not have to be certified to be a caregiver. You do not have to have any special training to be a caregiver. When somebody says that they want to be a caregiver, I work with them to see that they have some mentorship of some sort. And if they want to take a course, there are some free courses available whereby you can become certified as a caregiver. We need young caregivers here on the island. Our older group of caregivers are retiring, and so it's the same thing as nursing. So it pays very well. It pays between $25 and $35 an hour. Sometimes you have to put up with crotchety old people. Sometimes you have to put up with people who are taking medications that don't make them feel well. Sometimes you have to do strange overnight hours. Sometimes you have to deal with personalities that are difficult. Sometimes you have to just watch things in the home that you may not agree with. But those are all things you go on to deal with in nursing anyway, if that's a path, healthcare is a path you want to go. So if you're interested in caregiving, speak to Michelle, you can speak to me, and there are opportunities for caregiving here in the community. There's opportunities to take the training, as I said, for free and be licensed by the state of Washington as a caregiver. Then that's usually, I don't know that there's an age restriction on that, but I would say it really depends on maturity more than it depends on age. You know, whether or not you feel like you can deal with the dynamics of what goes on in a household when you have to be there and be providing care. What else? Has anybody in here thought about going into nursing? Yeah? Great. Have you looked into it?
No.
It's never, in my opinion right now, with the fact that we don't have enough nurses, and with the fact that we also, because we don't have enough nurses, we don't necessarily have enough educators. It's great to be thinking about it and kind of putting out your feelers, and when you are working for someone or you know someone, you know, be making those established contacts for getting somebody to write something about you, or that you could do some work for a summer that might, you know, help you in that direction. As I said, I'm really hoping it opens up, because we're all in trouble if we don't have enough healthcare providers, and there is real concern that we've burned out a lot of people over the last couple of years, and it's going to be a challenge for all of us. I mean, anybody who it could be any one of us here in the room that would have to go to the hospital, and if they're short-staffed, you're affected. Mm-hmm.
Oh, yeah.
Okay. Uh-huh.
think if I was starting all over, it would be an occupation that I was seriously considering. I really like the opportunities for travel, the demand, you know, that there's gonna be opportunity in every single city around the country and around the world. And I know the pay is really good. I know it's a really demanding job and stressful, but from what I've seen and what I've heard, I think there's just so much positive opportunity there.
Well, you know, talking about stressful, or I've never seen it that way for me personally working in it, because it's a part of kind of who I am, that I like to be present with people. So even though it could be stressful because, and I'm gonna just use both of you as an example, I know that they are having to deal with a life thing that's very, very difficult, but it's their experience. It's not my experience. I don't take it on as my experience. Instead, I stay present to what their needs are and their loved ones' needs are. So as an example, I may be there and I can see that they're struggling, but they would struggle even more if I didn't make sure that the knowledge I had about medications, about supplies they need, about making sure that they knew who to call at nighttime if they had a question. So my job wasn't really to get emotionally involved with them as much as it was to see that they felt supported so that they could get what they needed. So it's, you know, the stressful jobs to me are being in the ER, where you're just constantly inundated with trauma and families who have trauma, or long, you know, crazy hours or things such as that. Yeah. But it has changed. I mean, it certainly has changed.
If anyone like such as yourself or is interested in knowing more about nursing, maybe you leave here in a day or a week or months, decide, gee, I'd like to sit down with Debra and hear some
Oh,
more.
absolutely.
You can meet downstairs. I'd be happy to be part of that and help guide to, you know, what schools to consider apply for, scholarships.
Yeah, when I was a midwife, I had a number of young women come and, you know, follow me, and I know where they are midwives now, and so it's been fun to see people come into the profession and find a way to make it work for them.